rest of the world, Americans can't get enough of those tig old bitties, which is why boob jobs are the most popular cosmetic surgery procedure in the country. Over 300,000 people got implants in 2018. But what exactly are breast implants, and what goes into getting a shiny new pair? Breast implants are medical-grade artificial body parts that are inserted into the body during a breast augmentation. There are two main kinds of implants, silicone and saline. All implants are made with a silicone outer shell, but these also contain silicone gel inside, and the thick fluid mimics the feel of human fat, giving it a more natural feel. Within the silicone family, there are delicious-sounding gummy bear implants, but you don't want to eat these puppies. These implants are filled with an even thicker silicone gel and maintain their shape better than traditional silicone implants. Then there are saline implants, which are filled up with sterile salt water until they have the desired feel, firmness, and shape. Since they are filled up once the shell is inserted into the breast, they can sometimes wrinkle under the skin, and since saline isn't as thick as silicone, they won't feel as natural. With both kinds of implants, there's always the risk of infection, scar tissue that could change the breast shape, loss of nipple sensitivity, and leakage or rupturing. It's that last risk where there is a really important difference in the two. If the universe decided to play a cruel game of pop goes the boobie with a saline implant, your body just absorbs the salt water because it's natural. It's also way more noticeable when it breaks because it's a less stable material inside the implant. But when a silicone implant springs a leak, the gel inside can't be absorbed and can spread outside of the implant pocket to other parts of the body, which can be seriously dangerous. Even worse, this leak can go undetected longer because the implant is able to keep its shape despite the leak. There's no need to go down any weird internet rabbit holes to figure out which type of implant is best for you either. You'll be discussing this and so much more with your surgeon, who should obviously be certified by the American Board of Cosmetic Surgery or the American Society of Plastic Surgeons and work in an accredited medical facility. Aside from the implant itself, your surgeon will also figure out which type of incision is best for you. And Sorry, that word always makes me malfunction a little. Inframammary incisions are made in the crease in your underboob area, meaning that the scar is pretty hidden most of the time, and they allow for bigger implants to be placed inside with more precision. Periareolar incisions are made around the nipple so that any scarring looks like the natural color change between the skin and the nip. Surgeons usually use this when they are simultaneously performing a breast lift too. Transaxillary incisions are made up in the armpit, so the breast itself has no visible scarring, but the surgeon will need to use a special camera to get the implant where it needs to be. Once you choose an incision, the doc will tell you if the implant should be in a submuscular placement, under the pec muscle, or a submammary placement, behind the breast tissue and over the pec muscle. So, once all of these options are sorted out and you're put under general anesthesia, your doctor will make the agreed-upon incisions, slide your implant in, and close you up with stitches, skin adhesives, and surgical tape. Then, once you're fully awake, you should be able to walk out within a couple hours on the same day, which is pretty nice considering how intense the surgery is. You'll also have some fun goodies to take up with you, like a support garment bandeau that you have to wear 24/7 for a couple weeks. Fashionable. You also won't be able to do any strenuous activity for about 6 weeks, because if you think about it, going for a jog with newly minted stitches is probably the worst idea anybody could think of. My boobs hurt just thinking about it. A big glaring red flag found in the small print of this surgery is that breast implants are not guaranteed to last a lifetime, and you might need more surgeries in the future to keep them looking good. Also, getting pregnant, losing a lot of weight, or going through menopause can affect your implants. Look, even with the risks and upkeep involved with breast implants, there are plenty of benefits associated with them. Now that people can find out if they have a high risk of breast cancer or if they've already had some kind of mastectomy, breast augmentation can be a powerful tool for regaining health and self-esteem. Breast implants can also be extremely meaningful to trans women as a part of gender confirmation. Since boob jobs have become somewhat associated with American bodiness and excess over the last couple of decades, it can be hard to remember that at its core, breast augmentation is supposed to help people feel good about themselves. But now that we know what goes into those augmented boobs, hopefully we can all appreciate them a little bit more.